Bismillahirrahmanirrahim. Assalamu alaikum dear students. We are here with the second part on the factors affecting rate and extent of absorption of a drug. As I already told you, absorption is one of the pharmacokinetic processes. So let's move on. Just a quick revision. What is pharmacokinetics? It's a branch of pharmacology which deals with absorption, distribution, metabolism, and excretion. And it is what the body is going to do to the drug inside the body. Okay. So the proper definition of absorption is passage of drugs from the site of administration to the systemic circulation. Then we discussed in our previous lecture about the factors affecting rate and extent of absorption. We divided them into two main categories, that was drug related factors and number two was patient related factors. In the drug-related factors, we discussed about the various properties or the physiochemical properties of a drug which can affect the absorption of that particular drug, in which the most important one was lipid solubility, which has a direct relationship, degree of ionization. If a drug is more ionized, it is going to be water soluble, polar, and hence its absorption would decrease. Then we discussed about the concentration of the drug, the physical state, molecular size, dosage form, and particle size. We also discussed about what is disintegration time, which is the rate of breakup of the drug inside the body, and dissolution rate, the rate at which it goes into solution. Formulation of a drug, is it manufactured by one company? How its pharmacokinetic is going to vary as compared to the manufacturing of the drug by another pharmaceutical company. So, how do we define dissolution rate? In order for absorption to occur, a drug or a therapeutic agent must be in the solution form. So, what should be the form of the drug? In the solution form. This means the drug administered orally in solid form, for example, tablet, capsules, or as suspension, must dissolve in GI fluids before absorption can occur. So the important thing is that you make a concept in your mind कि अगर drug ने body के अंदर absorb होना है, so it should be in the solution form, and अगर आप orally दे रहे हो या suspension की form में दे रहे हो in liquid form, whatever it is, it must dissolve in the GI fluids before absorption can occur. So it is the prerequisite step. So this diagram is further explaining the nature and type of dosage form. As you can well appreciate that the slowest is with tablet form, then capsule, powders, suspension, emulsion, and solution has the fastest rate of absorption. And disintegration of the tablet into granules, and powders and suspensions are disintegrated into fine particles, and dissolution occurs in the drug in solution form, is then absorbable and then process the various drug-blood barriers. So what is important to remember, the fastest rate of absorption is when a drug is in the solution form rather than a tablet form. And of course, you all know that whenever the drug is given through parenteral route, that is intravenous route, one of the most rapid absorption, rather it directly reaches into the systemic circulation. Why? Because it bypasses the first pass effect. First pass effect, or it is also called pre-systemic effect or the pre-systemic metabolism. Okay? That is why we say that the intravenous route has 100% bioavailability. It is available in the body in unchanged form, right? And before entering into the systemic circulation, unchanged form, it is 100% available, so that intravenous route has got the maximum bioavailability. Whereas the drug given through enteral route, enteral can be oral, can be rectal, or any other route, the drug has to undergo first pass effect. So as a general rule, the bioavailability of drug varies in dosage form in the following order. The maximum is seen with the solution, and the slowest one is in the sustained release products. Now we move on to the lipid solubility or lipid aqueous partition coefficient. How do we define it? So it is the measure of how readily a drug enters the lipid medium from an aqueous medium, which is the most important drug-related factors which affect the rate and extent of absorption. The more the drug is lipid soluble, the more rapid it is going to be absorbed. So this is a clear-cut diagram showing that the lipid soluble drug is in the non-ionized form and ionized drug is in the water soluble form, and it cannot cross the membrane, cell membrane. Then we discussed about the effect of pH on the drug absorption. As already mentioned you quite a couple of times that acidic drug is better absorbed in the acidic medium and basic drugs are better absorbed in basic medium, and acidic drug aspirin are better absorbed in the stomach in acidic medium, and basic drug are better absorbed in the intestine where there is alkaline media. For the excretion, remember the rule is opposite. Acidic drugs are excreted in the opposite pH medium, which is the alkaline medium, and basic drugs are excreted better in the acidic pH. So if there is a toxicity of a drug which is acidic in nature, for example, acidic drug is acetyl salicylic acid, which we also called as aspirin. So what you need to do is you have to alkalinize the urine. Remember students over here, this is a very important past question which has been repeatedly asked in your third professional exam of the SEQ, that if there is toxicity of an acidic or basic drug, how with the help of this ionization or the Henderson-Hasselbalch equation, you will help in the elimination of that drug. So remember the rule is the same. If there is toxicity of acidic drug, you make the urine alkalinize by adding some basic drugs, okay, like sodium bicarbonate. So what happens generally as a rule that acidic drug in opposite medium, which is the basic medium, becomes ionized, and as I showed you earlier in the earlier slide that in the ionized form a drug becomes polar, that is the water soluble, so it is not absorbed, it is excreted. And same as for the basic drug poisoning, if there is a toxicity of any alkaline drug, so you have to acidify the urine by giving ammonium chloride, and so the drug becomes ionized in that opposite pH. For absorption, you need the same pH as that of the drug, pK, and for the excretion of the drug, you need the opposite pH. All right. So we also discussed about the patient-based factors, and we have discussed in detail the routes of drug administration. The lecture was taken by Dr. Faria, your assistant professor, and the pH of the absorbing surface. Surface area of absorption has also a direct relationship. Greater the surface area, greater would be the absorption. Thickness of the diffusing path has an inverse relationship. Then vascularity has a direct relationship. Now if we move on to further details, which we have already covered, was absorption from the GIT. We have discussed all these factors. Now let's move on to today's topic, which is degree of ionization of a drug. So how do we define it? The extent to which a drug becomes ionized depends upon two things: pH of the medium and pKa of the drug. Students, kindly note this point. Ionization depends upon two factors, pH of the medium and pKa of the drug. ड्रग का pKa होगा और मीडियम जिसके अंदर ड्रग ने एब्जॉर्ब होना है उसका हमने pH देखना है. फॉर एग्जांपल स्टमक से अगर ड्रग इज गोइंग टू बी एब्जॉर्ब्ड, सो यू शुड नो कि स्टमक का pH कैसा है. एंड इफ द ड्रग इज एसिडिक, फॉर एग्जांपल एस्पिरिन, so it would be having a pKa of 2.5 or 3.5, which is the acidic. So there would be more absorption of the acidic drug in acidic pH. So acidic drugs remain unionized in the acidic medium. So now apply the rule. If a drug is in non-ionized form, unionized form, it is lipid soluble. It is going to have more absorption. And basic drugs remain mostly unionized in the alkaline medium, which is the intestine. And there are some drugs also which are highly ionized. For example, negatively charged heparin, which is an anticoagulant, and positively charged tubercularine and hexamethorium, which are neuromuscular blockers. Whereas some drugs, they never ionize and they remain unionized. For example, digoxin and chloramphenicol. Digoxin is a cardiac glycoside which is used for the treatment of heart failure, and chloramphenicol is an antibiotic. ठीक है, तो आपने याद ये रखना है कि जितनी ड्रग अनआयनाइज्ड होगी उतनी ज़्यादा उसकी एब्जॉर्प्शन होगी, लिपिड सॉल्युबल फॉर्म में होगी, इट कैन क्रॉस द मेम्ब्रेन्स, whereas जितनी ड्रग आयनाइज्ड होगी that is going to be water soluble, polar, and it's not permeable to the lipid bilayer. Okay, so this is the Henderson-Hasselbalch equation. Remember one thing, majority of the drugs are either weak acids or weak bases, and how do we define them? As you can see, this HA is the protonated form of an acid. Proton is shown by hydrogen. So when it dissociates, it gives up a proton and an acid. So weak acids, if you can see the red ones, which is HA, it is not having any charge on it. So for weak acid, the protonated form is non-ionized. Whereas in case of base, Hb plus, it is giving a proton and a base which is free of any charge. So for the weak bases, how do we define which form is more absorbable? That form is obviously more absorbable and readily crossing the membranes, which is not having any charge. So you can appreciate that HA, which is a protonated form of an acid, is more absorbable, whereas unprotonated form of a base is more absorbable. ठीक है, so you should know this concept कि एसिड को अगर आप दोगे तो एसिडिक ड्रग जो है वो प्रोटोनेटेड फॉर्म में ज़्यादा एब्जॉर्ब होती है और जो बेसिक ड्रग है वो अनप्रोटोनेटेड फॉर्म में. ऑल राइट, so HA and B are unionized, whereas HB and A are ionized form. Now few terminologies. Number one is dissociation constant and pKa. So how do we define Ka? It's the dissociation constant, and pKa is the negative logarithm of the dissociation constant of a weak electrolyte, whether it is an acid or a base. So remember one thing, जब ड्रग ने एब्जॉर्ब होना है तो आपने pH देखना है absorbing surface का या मीडियम का, और जो ड्रग का देखना है you have to see the pKa. So pKa is the measure of the strength of interaction of a compound with a proton. The less the interaction, the lower is the pKa. ठीक है, अगर तो इसका interaction is very strong, ठीक है, तो it means इसका जो pKa है that is more. Since acids have a tendency to donate proton, you all know that, so it means that they have less interaction. The bond is not so strong, it readily gives off a proton, so they have a lower pKa. Thus the lower the pKa, stronger the acid. ठीक है, क्योंकि acid को हम define ही ऐसे कर रहे हैं कि which gives up a proton. So और pKa होता क्या है? It's a measure of strength of interaction of compound with proton, but acid is readily giving its proton, so the lower the pK, stronger the acid. Okay, and opposite for the base. Henderson-Hasselbalch equation is pH is equal to pKa plus log unprotonated form over the protonated one. For acid, we have just seen that the unprotonated form is A negative, which is ionized. अभी हमने जो equation देखी थी, the HA that was giving out a proton and acid. So HA was free of any charge, so that was non-ionized form. ठीक है, and for the base there was कि जो protonated form है BH plus, that was ionized. So you have to remember this equation, how it is derived, what is its clinical significance. So if we move on further, we can see that if we consider that pH of the medium is equal to the pK of the drug, so we can derive this equation as pH is minus pK is log ionized over unionized form. So if the difference is 0, pH minus pK is 0, then the 50% of the drug would be in ionized form and 50% would be in non-ionized form. For example, if you get a clinical scenario that aspirin or any other drug which is having a pKa and pH of same um, value, then the pH minus pK is going to be 0. So 50% of the drug would be in absorbable form and 50% would be in non-absorbable form. So this is a very important numerical which at the end of your mini catching you have multiple questions, you have to do it, and this often comes in your exam in form of MCQ and even in a scenario based SEQ as well. Okay, so if the ionized and unionized form is divided and they have equals to 1, then the pH percentage of the drug is ionized in 50% of and the 50% is unionized. ओके सो न्यूमेरिकली इक्वल टू पीएच, अगर हम न्यूमेरिकली बिकॉज पीके ड्रग का है, अगर वो 3.5 है और पीएच भी उसका 3.5 है जिस मीडियम में उस ड्रग ने एब्जॉर्ब होना है, तो वी कैन से द ड्रग इज 50% आयनाइज्ड एंड 50% unionized. Classical example is that of aspirin. Aspirin is an acidic drug which is absorbed more in the acidic pH, and acidic pH is that of the stomach, and the pKa of the acidic drug is 3.5. So 50% of the drug would be in ionized form and 50% would be in your non-ionized form, right? So this is a table to explain how the pH and pK affect the absorption of a drug. So this you can see that there is pH minus pKa. So it is telling about the weak acid and weak base. Remember one thing, this table gives us the concentration in which is the non-ionized or absorbable form. ठीक है, अगर आपको कोई क्वेश्चन आए फॉर एग्जाम्पल कि एस्पिरिन है जिसका pKa इतना है और pH उसका फॉर एग्जांपल 8 के ऊपर, उसकी कितनी फॉर्म आयनाइज्ड होगी और कितनी नॉन आयनाइज्ड होगी। पहली बात तो ये कि कॉमन सेंस इन्वॉल्व करो, ठीक है। एस्पिरिन एसिडिक ड्रग है, अगर पीएच जो है 8 के अंदर अल्कलाइन के अंदर, वो ड्रग ज्यादा एब्जॉर्बेबल फॉर्म में होगी कि नॉन एब्जॉर्बेबल फॉर्म में होगी, ठीक है। ऑपोजिट पीएच के अंदर क्या होता है कि ड्रग बिकम्स मोर आयनाइज्ड, ठीक है, आयनाइज कर जाती है ना ऑपोजिट पीएच के अंदर, सो इट इज गोइंग टू बी वाटर सॉल्युबल, इट इज गोइंग टू बी पोलर, इट इज गोइंग टू बी एक्सक्रीटेबल। सो सेम पीएच के अंदर जो ड्रग हैं जैसे एसिडिक या बेस अपने रिस्पेक्टिव पीएच के अंदर दे बिकम मोर एब्जॉर्बेबल और अनआयनाइज्ड, ठीक है। तो इन दिस टेबल you can well appreciate that if we know the value of pH minus pKa, which is -2, -1, 0, +1 or +2, so in case of weak acid, the non-ionized or the absorbable form, it gives us the value of 99, 90, 50, 10 and 1. And this gives us the value 1, 10, 50, 90 and 99. So we can say कि if a drug is having pKa of 2.5, ठीक है, and in the pH of 2.5 and the drug was acidic, so what is the absorbable form, ठीक है। पहले आप तो बात करो कि एसिड की, तो उसका जो 2.5 minus 2.5 is going to be 0. तो we can say कि at 0 के ऊपर अगर 0 वैल्यू होगी तो 50% of the drug would be non-ionized and 50% would be ionized. ये तो हमने पहले ही पढ़ा कि if the pH and pK of the drug and the medium is the same numerical value, then 50% will be ionized and non-ionized. So same rule you are going to apply to the next question which I am going to show in upcoming lecture. Before that, this is a diagram showing how the weak acid enters the lipid bilayer. So as you can see that HA, let me use the pen. Okay. As you can see that HA, when dissociates, it gives a proton, which is the definition of an acid. It gives a proton and acid, and since this is charged and this is charged, it is not going to cross the lipid bilayer. So the protonated form of an acid is absorbable form or the lipid soluble form. So it crosses the lipid bilayer and moves into the body compartment. And for the weak base, as you can see, the base when dissociate into hydrogen and the protonated form of a base. It is also charged, it is also ionized. So we can say that unprotonated form of a base is lipid soluble and it crosses the membranes. Okay? So now students, there is a question. Okay, morphine is a weak base. pKa is 8. Okay? Since it's a base, its pKa is 8. What percentage will be in the ionized form in the urine at the pH of 6? So as I showed you the table in which it was telling us about the non-ionized form, which is absorbable form, which is a pH minus pK. So if you put pH minus pK, the pH is 6. ठीक है, urine का pH is 6 and the pKa is 8. So it is 6 minus 8 is minus 2. So since it's a base, let's see how we can further proceed. So 1% of morphine is in the non-ionized form and 99% is in ionized form according to the table. So which means that the basic drug, it is asking कि ionized form में यूरिन का पीएच अगर एसिडिक है तो क्या होगा, तो व्हाट इज द आंसर कि 1%, only 1% would be in the non-ionized form, 1% is in the absorbable form and 99% would be ionized, so it is going to be excreted. ठीक है, so weak base when comes in the opposite pH of the medium, so what is happening that it becomes ionized. ठीक है, so 99% is ionized. So if the pH is increased by 1 unit, then there would be, it means that 1 unit change in pH causes 10-fold change in ionization. If an acidic drug such as aspirin is put in a medium of 2.5, ठीक है, अगर हम कहते हैं pK of aspirin is 3.5, so अगर it is put in the medium of 2.5, then 90% of the drug will be protonated or in the unionized form. ठीक है, protonated is HA, which was without charge, which is unionized, which is absorbable, which is lipid soluble. All right. So from the Henderson-Hasselbalch equation, when the pH is less than pK, the protonated form of acid, which is unionized, and the ionized form or the protonated form of the base dominate. ठीक है? When the pH is less than pK, and if the pH is greater than pK, then the deprotonated or the form of the acid and base, they are dominating. In other words, we can say that acidic drug will be more unionized in acidic medium, thus better absorbed, and basic drug would be ionized in an acidic medium and less absorbable. ठीक है? Okay, by the end of this lecture, we have already covered the various factors affecting absorption, which were drug related and the patient related factors, and the most important one today which we discussed and emphasized on was ionization, degree of ionization, and the concept of Henderson-Hasselbalch equation, and you have to apply this equation and the concept of ionization on this question and submit it on your respective WhatsApp groups. And students, I have not repeated the other factors which you have already covered in detail, like the various routes of drug administration which affect the absorption and the first pass effect, which has been covered repeatedly. So what is left is we'll be discussing about the bioavailability in our next lecture, and for that you have to go through your mini Katzing's end of chapter MCQs, and if you have any query or question you can ask me. With that, Allah Hafiz.